So look here, this is the mandible. This is, imagine looking at a person from the front view and the person is looking up. So you can see there is the lower mandible, there is the chin, and here would be your mylohyoid. There's the anterior digastric bellies, going through a little ligament connecting it, that connects to the hyoid bone, coming out and forming the posterior digastric, which attaches to the mastoid bone. Here is your sternocleidomastoid, the muscle. That's the sternal head and the clavicular head. That's why it's called sternocleidomastoid. 3 sites of attachment. There's your omohyoid attaching to the scapula. The sternohyoid has been cut to show the sternothyroid, thyrohyoid, and cricothyroid, and that is there, the cricothyroid. And this here is your thyrohyoid. So here is the sketch of a person looking to the side, and we can see the neck. That's the front of the neck, and that's the side of the neck. There's your trapezius sternocleidomastoid here. That's the inferior belly of the omohyoid, so it comes up here. And there's your posterior belly of the digastric, and that's the hyoid bone. There's your sternothyroid and sternohyoid muscles. Now, the area between the trapezius and sternocleidomastoid is called the posterior triangle, and everything anterior to the sternocleidomastoid is called the anterior triangle. So here, all of this is the anterior triangle, all of this is posterior triangle. The anterior triangle is further divided into the submandibular triangle, which is the area right under the angle of the jaw, and the carotid triangle, where you can feel the pulse of your carotid artery. Okay, so the borders that form the margins of the submandibular triangle are formed by the mandible and by the digastric muscle, both anterior and posterior bellies. So the submandibular triangle is also known as the digastric triangle. Okay, the carotid triangle is bordered by the sternocleidomastoid, superior omohyoid, and the posterior belly of digastric. So this triangle here is your carotid triangle, where you can feel the pulse of your carotid artery most strongly. So looking here, this is the anatomy of the posterior triangle. So this here is your sternocleidomastoid, and this is your trapezius. What you can see here are the muscles within your posterior triangle. Down here is your deltoid muscle, pectoralis major, the clavicular head and the sternocostal head, subclavius muscle underneath that, and the pectoralis minor beneath the pectoralis major. So what do we have in the posterior triangle? First, you see that's the inferior belly of the omohyoid muscle. There's the superior belly, and the muscles here include the most deepest one is the semispinalis capitis. Superficial to that is the splenius capitis, then the levator scapula, and then 3 muscles, 1, 2, 3. The posterior, middle, and anterior scalene muscles. The anterior and middle scalene muscles attach to rib 1. Remember when I talked about the scalene tubercle? Well, that is where the anterior scalenus muscle attaches. So the subclavian vein comes anterior to the anterior scalene muscles, and the subclavian artery comes posterior to the anterior scalene muscle. Okay, and the brachial plexus also emerges between the anterior and middle scalenus muscles, and the posterior scalenus muscle attaches to rib 2.